Welcome back. When Trudy Lightich visited Dr. Shel, she was hoping to regain some of her youthful energy, but the end results were much more. Not only did she feel like she drank from the fountain of youth, but she looked at it like it as well. Yeah, there we go. You pull me over there and I wouldn't stop drinking. Okay, here to tell us how she did it, please welcome Drshelenalaljiesthetics from Dr. Shel Wellness and Medical Spa and her patient, Trudy. All right. So the thing that oftentimes brings us in, Dr. Shel, is when we start feeling bad.
Absolutely.
And so then it gets to the point where we can't stand it, then we start seeking answers.
Absolutely. So, you want to feel your absolute best, right? You want to have tremendous amount of energy, feel good, have great moods, sleep well, lose weight, look great, have great muscle mass.
You got an amen corner over here.
Let's not forget great libido, so that brings you in.
Oh, great libido. She added that one in there too. All right. Now, here's the thing, but a lot of us don't come in because we think that's just what aging is. There's nothing we can do about it.
Yes, and we need to know that there is. We can now be proactive and know that at any given age, as a woman, you can feel all of those things naturally by balancing hormones and nutrition and your thyroid.
Because that's usually what's going wrong, is that we have a diminishing of hormones,
Absolutely.
so you replace that.
Yep.
All right, so Trudy, when did it hit you that, gosh, I just can't keep going like this?
A couple years ago, feeling tired, and I don't know how I stumbled upon Dr. Shel, but I was looking for
You were watching
that.
I
was watching. Maybe I was watching the show.
Yeah.
And did the bioidentical hormone.
What did you know about it before then?
Not much, not much, but we did the testing, and she went through the list of all the things that we needed to adjust, and have been on that. It's been wonderful.
Yeah, all right. So Dr. Shel, a lot of times what people have done is we've gone to doctors and said, I feel like this. I was told by one doctor, you're old and you had a baby.
Oh,
I'm like, okay, that's not a diagnosis.
Exactly.
Right. Okay, and then but others who said, well, I can give you this for this symptom, this for that symptom, that for that symptom. Instead, it's bioidentical hormones. If we're diminished, if our hormones are diminishing, then you would replace it with
you replace
natural
them naturally,
hormones.
Exactly. And you don't want to use a Band-Aid effect and keep getting on different prescription drugs, because none of us are deficient in Prozac.
Right.
We know that. We are not deficient in that. We are deficient
I'm low on Adderall.
There you go.
But I say that laughing, but a lot of women are prescribed Prozac. A lot of women are prescribed the Adderall to get their energy back up, and then you have a cocktail that all damages your liver, and you're no better than where you were. All right, so you started feeling better. And then, because Dr. Shel focuses on inner beauty and outer beauty and the whole bit, you start noticing there's a few other things she offers.
A couple things were dropping a little bit. Let's do a little touch up here and there. So have done a little.
So here we go. Here's some kind of some before and afters. But Dr. Shel, you have the things like Botox and fillers and laser genesis and old therapy. Let's go through what you did on Trudy's face.
So Trudy was already so beautiful. We just needed to lift things up. So what we have had over here is when you start losing, so Trudy's lost about 40 pounds.
Wow.
And she's looks
Is that
great.
because you were able to change your diet and then the bioidentical hormones?
The thyroid, the hormones, the balancing everything, eating healthier.
Because that impacts your metabolism.
And the thyroid impacts your metabolism. So once she did that, then everything starts going downhill. And so we want to lift it up. So the first thing we do is we want to stimulate that collagen, use things like L-therapy, which is based on ultrasound, very safe, no downtime, non-invasive, and that lifts things up non-surgically, non-invasively.
Look at that pretty jawline you got going on there.
So nice. And then you do something called tight lace, which actually stimulates it even more. And I know Trudy loved that.
I love that one.
Yeah, she loved that because she saw immediate results with that.
Yeah.
And then some, Botox and fillers, you feel like everybody does them. But the thing is, you need to know what you're doing. It's an art. It's not just put some here and here. You've got
just
to
because
really...
someone has a syringe in her hand doesn't mean that they know how to use it.
Doesn't mean they know what they're doing. And so you really are able to lift the cheeks, lift the eyebrows, lift the eyes, lift the marionette line. So this patient that you see on the screen has had, if you look at her face, there's no surgery there. It's all done with lasers, L-therapy, and fillers, so no surgery, no downtime.
They look like they're well rested, as opposed to looking like they got something done.
Absolutely, but they look like their own versions of younger selves.
All right, so that's the face, neck area, but there's also other parts of our body, cool sculpting, and the cellulite, new technology for that reaction.
So everything gets looser and drops, and we all have pockets of fat that we don't like. So cool sculpting is all about freezing that fat permanently. So we actually are able to get rid of the fat cells permanently but safely because they get frozen and they go through natural apoptosis.
Yeah. Right. Cellulite, which is the thing that just plagues so many women.
Everybody's got that, yes.
Speak for yourself, sister, 'cause I do have to say, my skinny friends at the swimming pool go, "Oh, I hate you." I'm like, "Well, you're skinny. I just don't have cellulite." But anyway, okay, so yeah, the new technology Reaction.
Reaction Viora is great because it uses a suction device as well as some radio frequency so that we break down the cellulite and get rid of it. But it's also great for body sculpting. So you have no cellulite, but we can sculpt a little bit there.
Yeah, you can. There's stuff. No, there's stuff to sculpt. That's for sure. All right, lift, tighten, and tone your female self. We have Incontinence and Intimidase.
Yes, so everything gets a little aged, unfortunately.
Yeah.
So, you know, there are things that we can essentially tighten in the feminine rejuvenation area as well and feel younger and more youthful and really get rid of that incontinence without surgery.
Yeah.
So that's wonderful. Women love that they don't have to go through surgery and they can still feel better about themselves.
Okay, that's a whole different day at the spa, isn't it? Well, Dr. Shel has a special offer for viewers. The first 50 callers will receive a free consultation and up to 25% off all aesthetic and bioidentical hormone therapy packages. That's amazing. To take advantage of this special offer, call 281-313-SHEL, 281-313-SHEL. That works out to be 281-313-7435, 281-313-7435. You can also log on to drshel.com. That's with one L. And while you're there, don't forget to download the ebook, Lift, Tighten, and Tone Without Surgery, and that is for free. You'll be all ready to